Hi everybody, good afternoon. My name's Vergil Briones. Please call me JV. I'm a senior SSP. I work alongside Dr. Monahan. And I'm not actually an expert when it comes to Lynch. My role as a screening practitioner, again for the BCS, is I see patients in clinic who are suitable to have I see patients in clinic and determine whether or not they are suitable to have a colonoscopy or a CT scan as a bowel investigation. Now, the point of having an SSP is to make sure that patients, such as yourselves, will undergo your screening journey with a high-quality colonoscopy, and of course, safe, and that the experience is as pleasant as possible. Now, we've had several topics earlier, quite heavy. We were talking about biomolecular, genetics, etc., statistics. So we'll talk about something that's a bit easier, bowel prep. But unfortunately, bowel prep is not very easy, is it? So I need you to take a look at the following slides and the following clips. Oops, sorry. Exactly. Right, so now that I've got your attention, bowel preparation or poor bowel preparation actually accounts for 25% of cases. Although this is not true for the bowel cancer screening program, but this number is 25% across the whole UK. I forgot if I got this from 2020 or 2021. But poor bowel preparation actually has consequences for patients. So first of all, it just prolongs the procedure time. It makes it harder for the endoscopist to go all the way into the cecum because of all the washing that needs to be done. And of course, because there are stools in the bowels, we tend to miss polyps. We tend to miss small lesions inside the bowels. And for people such as yourself, for people who have Lynch, your polyps tend to be on the flat side, so not as easy to detect. And of course, poor bowel preparation is also one of the leading causes of post-colonoscopy colorectal cancer. In our practice, we have determined an unofficial trifecta of the factors that we need to consider when it comes to dispensing bowel preparation to our patients. We've got an unwritten rule that if a patient comes into the procedure room with poor prep, that means you have done a failed clinic, and we don't want to fail. In your experience here with your previous colonoscopies, did you get a telephone appointment and then the bowel preparation was just emailed to you? Or sorry, not emailed, was just posted to you? Okay. Did you have someone on the other side of the telephone to walk you through the instructions? No. And before mailing the prep to you, did you have someone asking you about what your bowel habits are? No. Okay, so that's different under the bowel cancer screening program. So we try to mix these three. We need to determine the patient's right diet. Again, this will be dictated by by your existing bowel habits, and the right bowel preparation, because we believe that one size does not fit all. And we also need to determine the right patient, because everyone has different lifestyles. And again, not one bowel preparation will suit everyone's lifestyles. So before we talk about the right diet, I think it's best to familiarize ourselves with the digestive system, as we already know. That's from the mouth to the anus, and that's 5.5 meters worth of lumen that needs, the food transits through. And to journey that 5.5 meters, food takes 24 to 72 hours. And because of this, we may have to extend patients' diets for up to 3 days. The length of time when we tell patients to change their diet, again, is dictated by the type of bowel movements that they have. In some instances, we may also have to ask patients to extend their diet up to 5 to 7 days, but then those are special cases for which we have to discuss with our consultants. When it comes to food transiting from mouth to anus, we find out that it takes lesser time for simple, low-fiber foods to their journey as opposed to complex and high fiber, because obviously fiber, roughage, they tend to stay, or they tend to stay in the bowels and stay in the bowel walls. So an easy way to remember, I'm pretty sure that when you receive your instructions from your screening centers, you got a whole list, but it's actually quite easy. Just follow the white diet. So everything white, white bread, white flour, white meat, and clear soups. Those are the ones that you should be choosing for up to 3 days before your colonoscopy. And everything else on this side, please avoid them. An important part of bowel preparation is having lots of clear liquids, again, up to 3 days before the colonoscopy. So it's not just about helping food transit from mouth to anus, but also it gives you that feeling of satiety so that you wouldn't be eating as much in those 72 hours. And also it also preemptively prepares you for losing those electrolytes when you undergo the bowel preparation. So it's just best to replace your fluids before you actually start losing them when you undergo bowel prep. Before I discuss bowel preparation, a bit of a disclaimer. So we've now limited our bowel preparation choices to these three. We've got Senna and Citramag on the far end, Movie Prep in the middle, and Plainview. Later on, we'll discuss some pros and cons about them and what type of bowel preparation we'll be dispensing depending on the type of patient and their bowel symptoms. Senna and Citramag, as some of you may already know, it's composed of 10 tablets of Senna and 2 sachets of Citramag, each sachet to be dissolved in 250 ml of water. Movie Prep, pretty popular. It's 2 pairs of sachets A and B, a total of 4 sachets, which you need to dissolve in 2 liters of water. So that's quite a lot. And then you've got Plainview. Plainview, it's made of 2 doses, total of 3 sachets. Dose 1 is 1 sachet mixed in 500 ml of water, and then dose 2, made up of sachets A and B, which you mix together in 500 ml of water. In 2019, St. Mark's has done this study to see how each of these bowel preparation measures up against each other. So first, we looked at their cleanliness based on the Boston score. So Boston score is a 9-point system which determines how clean the bowels are. So the higher you score, the cleaner your bowels are. So it evaluates the right, transverse, and left colon. So let's see what are the Boston scores for each of these bowel preparation. Can you make a guess which one would have had the highest Boston score based on your experiences? Movie Prep? Let's see. Senna and Citramag has a score of 6. Movie Prep is only 7.5. Meanwhile, Plainview has 8.5, which is why it is my own personal favorite bowel preparation. And I've tasted it as well. And I believe some of our consultants prefer if a patient's been scoped, has been prepped with Plainview. No? Okay. Now, the question is the volume that they're supposed to drink, do they find it acceptable? 91% of those who had Senna and Citramag say, yes, it is acceptable. But then again, with Senna and Citramag, it's 250 ml of water at a time for each sachet. Unfortunately, there are some side effects, such as abdominal cramping, although it's also present in Movie Prep and Plainview, but we notice that it's more common in people who've had Senna and Citramag. Movie Prep, they think it's also acceptable. It's 86%. And then 83% of patients say, yes, Plainview is also acceptable. Again, with Plainview, it's only 500 ml at a time of bowel preparation that patients have to drink. Now, is the bowel preparation pleasant to taste? 45% of patients say Senna and Citramag is acceptable, it's pleasant. 59% say Movie Prep is pleasant, I understand, and Plainview, well, just over half of them say that it is pleasant. So what can we do in order to improve compliance with bowel preparation? I think the answer is quite obvious. We need to make bowel preparation taste right. So we need to add to the flavor. I understand now that there are different flavors different bowel preparation now have flavors. And so they say Plainview Dose 1 is mango flavored now, Plainview Dose 2 is citrus flavored. I live in a tropical country. I've got a mango growing in my backyard. Plainview is not mango. I'm sorry. I'm sorry, people from Norgine. So, what can we do to improve the flavor of movie prep or any type of prep for that matter? Change the flavor. So, whether it's adding sugar to make it more palatable or diluting it in Diet Coke. When I tried bowel prep, my personal favorite are these. Have you seen these small pumps of concentrated juice from Robinsons? You've seen them? So in my opinion, that actually tastes better than diluting the whole thing in Diet Coke. Try it next time. Wash it down with a chaser. So for every glass of bowel prep that you have, keep in mind that you're going to have to be replacing your fluid loss anyway. So choose clear liquids that have a lot of flavor in them. So for every glass of bowel preparation, try to chase it down with, let's say, a cup of apple juice. Because then that's a clear liquid, and that additional liquid will also be helping you replace your electrolytes. Plus, that salty, sweet taste doesn't linger at the back of your throat, does it? And also serve it with plenty of ice. And bowel preparation is, it tastes better when it's cold. Now I want to reference this Coke Zero study. So basically, this study found out that Coke Zero is an acceptable solvent for PEG as opposed to water. Because of the improvement of taste, people found out that prep in Diet Coke is more palatable. And if it's more palatable, then it's also easier to swallow, don't you think? Yeah. Because of this, there's a higher percentage of patients who are more willing to take prep in Coke Zero as opposed to water. In fact, it's 55 versus 43%. The time to complete prep is faster with Diet Coke. I believe the data is, with water, it's like 76 minutes. Sorry, with Diet Coke, it's 76 minutes to go through the entire prep. And with water, it's 90 minutes. And because people are complying, it actually results in better quality of bowel preparation. So it's cleaner. It results in a higher Boston score. And interestingly, it did not affect their hydration or electrolyte levels. So Diet Coke. What else can we do to make bowel prep taste right? Split the dose. I understand with movie prep, because we're diluting the whole thing in 2 liters of water, 2 liters over 8 hours seems very challenging, doesn't it? Yeah, of course. So instead of looking at that container, which has 2 liters of water, try to divide it, psych yourself. Divide it into 4 doses of 500 mils each. And then try to set a goal for yourself to finish each 500 mils within 2 hours. And then right timing, although it doesn't necessarily affect the taste, but set aside time for you when it comes to taking the bowel preparation, okay? So the right timing, set aside time, avoid any errands, please, because the last thing I want is for you to be, doing your grocery shopping under the effects of bowel prep. So dedicate some time. And that is where, people like me, screening practitioners, come in. We schedule colonoscopies based on our patients' availability, based on our patients' schedules, because we want you to come for your colonoscopy. And I did not mention it there, but interestingly, there's actually a study in China, in Wuhan. Good things can come from Wuhan. There's a study that patients who have their bowel preparation instructions on their mobile phones are actually more compliant, and it resulted in better quality preparation, because it does make sense. You don't have your bowel preparation documents in front of you all this time, all the time. But what you do have with you at all times is your cell phone. And it's got a list of the food do's and don'ts. And of course, use a straw so the bowel preparation goes straight to the back of your throat, and you don't have to deal with the taste as much. Now, dealing with the effects of bowel preparation, as I mentioned earlier, set aside time. When cleaning the back passage, of course, multiple trips to the toilet may inflame your back passage, so try to blot, don't wipe too hard. And please avoid any wet wipes. I know that may sound counterintuitive, but wet wipes, they've got alcohol, sometimes they're also scented, but these actually do more harm than good because they strip the anus of its mucosa and then makes it more irritable. And in that regard, I would actually advocate, again, coming from a tropical country, I would advocate using water to clean the back passage, whether it's bidet that you installed in the toilet or a handheld bidet, which you can buy from Amazon. That's what I would go for. And finally, stay hydrated all throughout. Again, a good trick is to chase down every glass of bowel preparation with a chaser, okay? And then the right patient. When we have a patient in clinic, it's not enough that we say, okay, you're a Lynch patient, okay, here's your bowel prep, these are the instructions. It actually goes a bit deeper than that. During your appointment with a specialist screening practitioner, we will consider your whole medical history. We will also consider your bowel symptoms, your mobility, and whether or not you're capable of actually undergoing bowel preparation. So for patients who have, let's say, swallowing problems, for patients um, who have poor tolerance of large volumes of liquid, we would advocate for Sana and Citramag because again, it has the lowest fluid volume. It's 250 mils of water per sachet at a time. The challenge here is getting the 10 Sana tablets inside you within an hour, but then most people seem to be able to manage. And then you've got movie prep. Movie prep, we found, is one of the safest bowel preparation that we can dispense. We dispense it for a wide range of EGFR, so that's your kidney functions. On our guidelines, we can dispense it from for patients with an EGFR of 30 and above. But then we've also had some patients with kidney problems, and behind the scenes, we liaise with their nephrologists, and we come up with a plan on how to take bowel preparation. And the nephrologists actually advocate for movie prep as a bowel preparation because it's friendly to your kidneys. So that's why we give this as the safest option for patients, especially those with very complex medical histories. Sometimes some patients may be more constipated than others, and this is the instance when we may have to give extended movie prep. Now this is more challenging because extended movie prep is actually composed of 3 pairs of sachets A and B. So that's a total of 6 sachets mixed in 3 liters. I know it's a lot, but at the end of this cleansing period, they're gonna have clean bowels. So that means you're gonna have to undergo this colonoscopy only that one time. And we're also quite careful with giving extended movie prep. So with some constipated patients, we may also have to ask to extend their diet up to 5 to 7 days in combination with extended movie prep. We've done this for patients who open their bowels once every 2 weeks. That's possible, that's happened. And then when they come into the colonoscopy procedure room, hurrah, the bowels are clean. Plain view. So plain view is a low volume bowel preparation. And again, it's one of my own favorites because there's also a same day option. Because nowadays, we've been getting younger and younger patients who cannot take a day off work. For Lynch, we've got 25 and 35-year-old patients. So instead of taking, let's think about this way. Let's say you've got your appointment on a Wednesday. Normally, you would be having your bowel preparation on a Tuesday, the procedure on a Wednesday, and then the recovery period Thursday. So that's 3 days of work. And some people cannot miss all that. With Plainview, you actually have a same day option. Bowel preparation starts at 6 a.m. with Plainview. So the dose 1 you take at 6 a.m. and then the second dose you take at 8:30 a.m. The only downside is you're gonna have to have an afternoon appointment. But afternoon appointment is fine if it means that you still have that day to yourself instead of dedicating it to bowel preparation. And fasting, you can eat up to 7 p.m. the night before the colonoscopy. So that's actually a shortening fasting time for everybody. So we put all of these factors together. This is the reason why some of you, if you got invited to your colonoscopy by the bowel cancer screening program, you may find that you're spending more time in clinic with a practitioner. It's not because we don't have your records with us, it's because we want to assess you holistically, take into consideration your lifestyle, your bowel movements, and any previous diagnosis which may or may not be related to Lynch. And these factors will all come together so that we can provide you with the safest and most pleasant bowel preparation experience. So I would like to address a few, sorry, I have time, don't I? Yeah, I would like to address a few of the points that were mentioned earlier about some of your worries about the colonoscopy experience. Dr. Mona has already said this, but under the bowel cancer screening program, your procedure will be done by a certified screening consultant. So not just a consultant, someone who's actually done further studies. In fact, we've seen patients on their previous colonoscopy reports, they say tight and unnegotiable sigmoid fixation. So the procedure was uncomfortable for the patient. But then the patients will come to us under the screening program in the procedure room. And I can swear that I've had consultants who scoped the patients reach the cecum in under 3 minutes, regardless of the difficult or sigmoid fixation. And then the point of contact. So apart from the number that was flashed earlier, 0800 707 6060, I've memorized that number by heart by now. Apart from that number, you will also be provided by the screening center's own number. I'm not sure if you've been provided by your own screening centers, but in St. Mark's we do. We give them the option to contact us anytime between 8 a.m. to 6 p.m. to talk about any issues that they have about preparation or to inform us about their availability. And finally, with regards to the biopsy results, well, for biopsies outside of research, and I'm talking about polyps that we have removed, any tissue samples that we have taken from possible cancers inside the bowels, we normally have the results within 7 days. And then we tell patients about their results 7 to 10 days after the colonoscopy. Behind the scenes, there's a lot of chasing going on because, again, we want this whole experience to be as pleasant as possible, which means people will be complying and coming in for their screening colonoscopies. And that brings me to the end of my presentation. Thank you for this opportunity.
Any questions on bowel prep before lunch? Ian, surely.
Yes, sir.
30 years ago at St. Mark's, but it was interesting that obviously tailoring things to the patient is so important, and your slide of Diet Coke and Coke Zero got me excited because I really like Coke Zero, but I hate Diet Coke because the Coca-Cola organization has tailored the taste of Diet Coke to females and Coke Zero to males. So I was just wondering whether you see differences in males versus females with effectiveness and taste and stuff like that.
No, we don't have that data, unfortunately.
I
It's
think you should.
It's worth starting, yeah, for when I get my master's.